The major part of the program today is on a new type of diet. I had a colleague call me earlier this week. She said she wanted to be seen, and she said, you know what? I finally got my weight to where I want it to be, and it's stable. That's a big issue for how many people? Most of us in America. And it's not just America anymore, it's throughout the world. This is a giant and growing health problem. I asked her, I said, I knew that you'd had challenges in this space. I didn't know, how big the challenges were. I didn't know what all you'd done, but tell me what you did now to get there. And she said, bright line eating. So I looked it up. As she said, it was the thing that interested her was application of addiction science to food. It's very interesting to me. My dad was about 350 pounds at the time I was conceived. That in and of itself, and 5'10", my height. I weigh 160, so he was more than twice me. And that alone puts a target on my chest in terms of this health problem. It's an epidemiology issue. It's been found that in mammals, if the father is obese at the time of insemination, you greatly increase the offspring's risk for prediabetes and diabetes when they get my age, 60. But that's not really my only issue. I also have other epigenetics issues. Genetics, I think, is obvious. Epi means it's not so much changing the code, it's changing how your genetic code is manipulated, the librarian for all of these genes. And again, having an obese father has a epigenetic risk factor for what I've got, prediabetes and diabetes. Having a mother who developed diabetes of gestation, in other words, diabetes of pregnancy at the time they were pregnant. If you were the child in the womb, the fetus in the womb at the time that your mother developed prediabetes and diabetes of pregnancy, also another major risk factor. A third thing related to the second one is if you're born over 8.5 pounds. For humans, any ounce over 8.5 pounds is greatly increasing your epigenetic risk for prediabetes and diabetes as we age. We didn't know that 63 years ago when I was born. We just thought that was a fat, happy baby. I was not 8.5 pounds. I was 10.5 pounds. So I had a couple of strikes coming out of the womb. And then, I think the biggest issue really doesn't have so much to do with that, just the pure biology. The biggest issue is behavior. It's addictions. So I've always felt, in dealing with patients in this issue, as well as just dealing with myself, it's like, how do you deal with the addiction side of it? I know that at 165, I'm about 30 pounds less than I was in college. My first year in college, it was not the freshman 5 or the freshman 10, it was the freshman 30. I was working out a lot. I played soccer that year, but I was gaining some fat too. I was living with my grandmother who helped create a lot of this bad language, bad behavior, bad set of rules about food. And I was studying organic chemistry. So I was doing a lot of that during 3 months of that period, during the summer between freshman and the next year of college. And that's when I gained most of my weight. My blood pressure actually started going up. I reached 130/90 as, again, a freshman in college. So at that point, I got serious about weight loss, started doing a lot of long distance running, and I went low fat at that time. I remained low fat until my early to mid 50s, and then switched from low fat, high carb to the opposite, low carb, high fat. It became clear I could not metabolize carbs like most of us, especially as we get into middle age and older. So back to this book, I'm going to cover a couple of things about this book. One is that the numbers that this group is obtaining in terms of weight loss, both rapid and steady weight loss. One of their points is people say, no, you don't want to have rapid weight loss. Their perspective is you want to change your food habits. And if you go from a really, really bad set of food habits and food rules to a good set, sometimes that's going to result in some fairly rapid weight loss. The other statistic that you see with this group that's really good is their ability to maintain the desired weight, the goal weight. Now, the person that wrote this book, Susan Pierce Thompson, has a PhD in addiction science. She spends a lot of time talking about dopamine and impact of things like sugar on our nucleus accumbens, part of the nucleus involved in the addiction to food. So let's talk a little bit more about those specific items. She talks about bright lines. Let's just go ahead and talk about those right now. One of the basic concepts and where this comes from is some studies done around decision-making processes. So some of the research done with this was where they texted people just at random, a few hundred people, 4 or 5 times a day for a few weeks. And they just ask them, what are they working on? What are they thinking about? What issues are they dealing with right now? These people were not selected because of dietary issues. These people were selected at random. And 40% of the time they mentioned, yeah, I'm thinking about eating. The point was, when you have fuzzy rules around food, you spend a lot of time justifying to yourself, trying to say, okay, what should I do right now? Should I eat? Should I not eat? Should I wait till, it's like, should I go get a snack before I do the YouTube Live today? And if so, what am I going to get? And now I've been there. I've done a lot of that type of discussion. Continue to get great feedback regarding the webinars. And here's why. On the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CINT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.